Now, here's a story that will probably be interesting to everyone, especially three good doctors that study this, and even some of the ICU nurses that frequent my channel. Ohio State study 30% of student athletes have heart damage linked to COVID-19. Two studies published July 27th in JAMA, the Journal for American Medical Association, Cardiology, looked at how COVID-19 may impact the heart. In a study published in September, researchers from Ohio State University found that out of more than 2 dozen athletes from the university who tested positive for COVID-19, 30% had cellular heart damage and 15% showed signs of heart inflammation caused by a condition known as myocarditis. After mapping the hearts of 26 Ohio State University athletes using a process known as cardiac magnetic resonance, researchers found that not only 15% of students exhibited the rare heart condition, but 30% showed cellular damage. Cardiac magnetic resonance imaging has the potential to identify a high-risk cohort for adverse outcomes and may importantly risk stratify athletes for safe participation, study authors wrote. Recent studies have raised concerns of myocardial inflammation after recovery from coronavirus disease 2019, even in asymptomatic or mildly symptomatic patients. In other words, even if you don't get any symptoms sometimes, and even if you recover with only like mild symptoms, you can do or have severe damage to your organs. And this is just the heart. We didn't even talk about the lungs. According to the Mayo Clinic, myocarditis is typically caused by a viral infection with symptoms ranging from chest pain, fatigue, shortness of breath, to a negative impact on heart rate and rhythm as seen in conditions such as arrhythmias. The Centers for Disease Control and Prevention tweeted on September 17th, heart conditions like myocarditis are associated with some cases of COVID-19. Severe cardiac damage is rare but has occurred even in young, healthy people. Medical experts have previously warned the public of links between the novel coronavirus and heart damage, especially in young people. The National Heart, Lung, and Blood Institute and the National Institutes of Health explained that while COVID-19 most commonly impacts the lungs, as it is a respiratory illness, damage to the lungs can lead to serious heart complications. Because the heart needs oxygen to function properly, COVID-19 can damage the lungs, preventing enough oxygen from reaching the heart muscle and further restricting oxygen from reaching other important tissues in the body. A separate report by a group of U.S. doctors published in the Medical Journal, or JACC, warned of potential of heart damage to children from novel coronavirus. The report detailed the case of a 2-month-old infant diagnosed with COVID-19 who experienced a myocardial injury as well as a type of heart failure most commonly seen in adults. Most children with COVID-19 are either asymptomatic or have mild symptoms, but our case shows the potential for reversible myocardial heart injury in infants, said Dr. Madhu Sharma, the report's lead author. In a news release published on December 2nd, the group of doctors said the infant recovered with normal heart function and was eventually discharged with no heart failure medications. The presentation and clinical course of this patient mirrors 4 case reports of acute myocardial injury reported in adult patients with COVID-19, said Sharma. Another study published on July 25th in the journal Cell Reports Medicine found that COVID-19 has also been known to instigate inflammatory responses in the body, which can negatively affect the function of one's heart and brain. According to the study, researchers observed SARS-CoV-2 infecting human heart cells that were grown from stem cells in a lab. Within 72 hours of infection, the virus managed to spread and replicate, killing the heart cells. The researchers brought up the particularly alarming possibility that if COVID-19 can infect the heart cells in a laboratory setting, it could possibly infect those specific organs, prompting the need for a cardiac-specific antiviral drug screen program. So it's been proven. I mean, this is not new. I think they showed it because these particular people are healthy. So they don't have severe symptoms. So they may get it mildly, they may not show any symptoms, but the thing is, this particular pathogen still does damage that will show up later on. In other words, if these athletes have heart damage that goes unnoticed, say they go to the pros, say you have a basketball player that goes to the pros and he has undetected heart damage, he's going to fall dead on the court. That's how come they screen athletes with heart problems. They don't want to have athletes falling dead. And this could, catching the coronavirus, if they catch it severely enough, then it could ruin their chances to go to further pro sports where they can make money, such as football or basketball or even sports like hockey. This is not a typical virus. Now, this is not a typical virus. This is a pathogen in my estimation. And it is a bloodborne pathogen because they found coronavirus damage in people's feet, much less the upper body organs like the lungs, the heart, the kidneys, the liver, even the brain. They found coronavirus damage in brain cells. So for all you people saying that you have to have pre-existing conditions and stuff like that, no, you can still do damage. So like I said, this is not one to play with. And I think there's another article that's around the corner saying that a nurse that took the COVID vaccine still wound up testing positive for COVID. Hopefully her vaccine triggered the positive test, but we'll see. Well, anyway, this is a short one, short and sweet. Do have another COVID article coming, but we'll work on that later. Well, with that, that's all I got for this one. This is BGS out, and I'll see you guys on the next one. Peace.